Hello, my name is Mark Gibson, and you're listening to the podcast version of the Teagasc Signpost Series, a weekly webinar that promotes and examines sustainability in Irish farming.
Good morning, everybody, and you're very welcome to another Signpost Series webinar. One Health is an integrated approach to recognise the deep connections between the health of people, animals, plants and the environment. This morning we're going to explore this philosophy. Not only addresses global challenges like climate change, food security and emerging diseases, but also how it's been put into action here in Ireland. And we're delighted to be joined this morning by Dr. Niamh McLoughlin, Executive Director of UCD One Health Centre. Niamh, good morning. How are you keeping?
Good morning. Lovely to be here. Thank you very much for the opportunity.
And we're also joined by Teagasc Signpost Programme Training and Development Specialist, Mark Plunkett, who's going to help me with questions tomorrow. Mark, how are you keeping?
Morning. Good now. Good, Cathal. Morning.
Yeah. All good with you today?
Yeah, not a bother. Not a bother now. Yeah.
Super. And Niamh, we were having a chat there before we come on. Maybe you tell us a little bit about your main area of work and also maybe about your background as well.
Yeah, sure. So I originally started off as a biochemist working in the area of protein engineering. When I finished my PhD in UCD, I then moved to working in the diagnostic industry. So I worked in Abbott Diagnostics and in Trinity Biotech in research and development. But I suppose in 2007, I decided I was going to have a career change and I moved back to UCD to work in research management. So I've worked in research management there for the past 18 years. I've worked across the School of Ag and Food Science and also the School of Veterinary Medicine. I've also worked project managing EU projects and also an SFI cluster. So then last year, I was delighted when I started my new position as the Executive Director of the One Health Centre. So I've just joined the centre for a year, so things are progressing very quickly, but and I'm delighted to be here today to present on it.
Yeah, you have some interesting things to discuss later on. We're going to have a right chat as well afterwards. So, you're no stranger to agriculture either.
No, definitely not. And I've worked, I suppose, with a lot of the researchers within UCD who work in very close collaboration with Teagasc. So hopefully I'll know a few people that are on here this morning.
Super. Okay, Niamh, I think that looks good. So with that, we'll let you kick off.
Just to start off, first with a little bit of history. So in 2015, UCD decided to have a bit of a reshuffle. So they allocated the 38 schools under 6 different colleges. The college that the UCD One Health Centre is located in is the College of Health and Agricultural Science. Basically, this college brings together 5 schools, which are the School of Veterinary Medicine, the School of Medicine, the School of Nursing, Midwifery and Health Systems, the School of Agriculture and Food Science, and the School of Public Health, Physiotherapy and Sports Science. So I suppose when UCD were looking for a place to locate the One Health Centre, this was the perfect structure to support the centre, as it covers many of the traditional disciplines that kind of encapsulate the One Health framework. However, while we are centred in CHAS, we do still recognise the importance of contribution from disciplines across the other colleges and how they can make a difference. So we are very active at seeking engagement across all colleges in UCD. So I suppose next, just a little bit of background. So the One Health Centre basically was created as a bold new initiative, placing Ireland at the forefront of global One Health thinking. So while it was developed within UCD, and as you'll see when I continue to talk today, we do need to be connected worldwide. So first of all, last year when I started, my very first task was to help apply to become a WHO collaborating centre. So a WHO collaborating centre, there are basically institutes that are designated by the Director General to carry out activities in support of the organisation's programme. So there are about 800 collaborating centres worldwide, and currently in Ireland there are 6 of these centres. So I suppose the process is basically the WHO are interested in a particular area, and then we kind of we would negotiate tasks and deliverables. And then last October, we were delighted when we were officially designated a centre. So we are a collaborating centre for the European region, but we were also the first collaborating centre specifically on One Health globally. We have rapidly grown our centre since last year when it was launched, and we currently have over 400 members, and we're hoping our numbers will grow. So if anyone today would like to join as well, that would be fantastic. So I suppose just to discuss the management team a little bit. So the director of the centre is Professor Tony Houlihan, which many of you would know as the former CMO. Tony is linked to the School of Public Health, Physiotherapy and Sports Science in UCD. The deputy director is Dr. Gerald Barry, who works in virology, and he is located in the School of Veterinary Medicine in UCD. And then, as I've said earlier, I'm Niamh, I'm the executive director, and the school that I'm currently linked with is the School of Public Health, Physiotherapy and Sports Science. So as I've said, I've now worked in the School of Ag and the School of Veterinary Medicine, and now I'm in the School of Public Health. So I'm collecting all five. Just to give you a little background to the establishment of the centre. So first of all, Tony had engagement with WHO in Europe, who were interested in a collaborating centre in One Health. At the same time, UCD had expressed an interest and a desire to drive One Health research. So with the support from UCD and the college leadership, along with the ability for us to create a platform through WHO engagement, it made sense then to move forward and develop the centre. Just to say the aims of the centre, we have 4 aims. The first one is to transform systems by integrating human, animal, plant and environmental health. Next, we would like to build Irish and global capacity for prevention, preparedness and sustainability. We would also like to embed One Health thinking across teaching, research and policy. And we also would like to act as a catalyst for innovation and collaborative problem solving. Then next, I suppose One Health as a philosophy. So what is One Health exactly? So this is a question that I get asked a lot. So just to give a definition, so One Health is an approach to ensure the well-being of animals, humans and the environment through collaborative problem solving locally, nationally and internationally. So we at the centre aim for a world where humans, animals, plants and ecosystems thrive together. We also aiming for collective thinking across disciplines and sectors. We are hoping that it's going to be a new model for collaboration for Irish universities and beyond. And I think something that we really would like to state as well is that it's an inclusive movement. And what I mean by that is putting One Health into operation involves many diverse groups. And an example of this would be community engagement, which plays a very important role in the success of One Health initiatives. And this could be through disseminating knowledge about diseases, promoting behavioural changes to prevent the spread of diseases. If we look at how the important role that the community has played during the COVID-19 pandemic, I mean, when it hit and there was a variety of different ways in which we were trying to combat the disease, but one that was really important was to try and get the message out to the community of steps that would help along the way. So when it comes to One Health, the community is a very important part. As I've said before, it's not just a single topic or a single discipline. It's a framework, and it includes antimicrobial resistance, food systems, climate emergency, mental health, urbanisation, equity, plant health. But also it moves beyond zoonosis and disease into well-being, social justice and sustainability. And what I mean by that is basically, again, if you look at COVID and you look at what happened, so when we're trying to reach out to the community, reach out all around for people to follow advice, basically one thing that would be very important was trust. Like, do people trust the advice that they're being given? So when we're doing work on AMR, research on AMR food systems, what message is coming across and how do we get people to trust the message that's there? I think in this day and age, there's a lot of misinformation on social media, on the internet. I think with AI and steps like ChatGPT, what's happening is people are asking questions, and some of the information that's correct and the misinformation is being mixed in together. And also this is bad because now you've got correct information and misinformation in the middle of it, which also makes it sound very valid. So that's another area. In order to improve antimicrobial resistance, for example, we need people to understand and we need them to be able to decipher between correct information and misinformation. So that's why when I say that One Health spreads across all of the disciplines, it's not just the traditional ones. We're also talking about sociology, we're talking about law, we're talking about psychology. Another example of this is with policy. So in order to get improvements in some areas and also make improvements, we need people to follow policies. Sometimes the language in policies might necessarily make it easy for the people who are following it to understand, or it could also be misinterpreted. So that's another area. So we're involved with the Geary Institute and we're very interested in policy. So just to get across today, because I think sometimes One Health is just seen as something that is across veterinary medicine and agriculture. Our centre is being kind of assigned to put One Health into operation, and to do that we need a multidisciplinary approach. So you're going to hear that word a lot today, but I just wanted to explain why I keep saying multidisciplinary. That's okay. So what is our vision as a centre? Our vision is to become a world-leading academic hub for One Health. So we're hoping by 2030 that the One Health Centre will be globally recognised for excellence in research, education, policy impact and engagement. We would also like to strengthen our achievements as a WHO collaborating centre and be central to UCD's breaking boundary strategy. We would also like to be seen as a trusted national and international partner for complex global health challenges. We have a bold and inclusive vision. We see health as a shared condition. It's the interconnectedness between human, animal, plant and environmental well-being. We also hope that our solutions are grounded in equity, sustainability and justice, that it's a just transition. And we see a vision of having strong internal and external collaborations, breaking disciplinary boundaries. So again, this is something that is very important to us in trying to put the One Health framework into action. Globally and locally, there's things happening in One Health. It's really interesting for us to kind of collaborate or receive advice from people that have maybe further down the line in some of the areas. So as a centre, we're really hoping to build these bonds. We've already started, but we'd like to continue. And by 2013, as I said, have very strong internal and external collaborations. Also, we aim to transform education and capacity. So firstly, we're hoping to create an MSc in One Health, which will attract global professionals in UCD. We're also, the work that we're doing with the WHO is creating executive training, reshaping leadership in health, the environment and in policy. And we also would like to make major contributions to public literacy, civic engagement and school outreach. So just to say, another area that we're very interested in, and that's part of the One Health framework, is health literacy. At the moment, for example, we are in talks with a university that's come over from the US to a particular area in Ireland. And what they're actually doing is they're going in and they're going to events, sporting events and local events, and they are surveying people on their on general health literacy, and they're trying to create a baseline. And once they do this, then they'll be able to identify areas in which education which areas will benefit the most from education. So it's very interesting, and it's something that could probably be done throughout Ireland. And just to say, when I say interdisciplinary as well, the health literacy, there's a lot of health literacy currently going on in the UCD School of Business, which might not be the most obvious place for when people are looking for that research area. So that's why it's also very important for us to reach across the different colleges. So as part of our vision as well, we're driving impact through research and partnerships. So as I said, we're focusing on AMR, climate change, food systems, zoonotic risk and pandemic preparedness, along with everything else. We would also like to be seen as international leadership on EU and Glodium consortium. And we're also very interested in two-way learning with Global South and Sub-Saharan Africa. And part of our vision is to try and build a global movement. So as part of this, we have an annual One Health conference, and we're hoping that we will build the numbers by 2030 and have it as one of Europe's leading events. We would like also to influence policy, shape discourse, and empower new leaders, and advance One Health as a global community practice for public good. So how are we going to do this? The One Health Centre, we have 4 core domains. These are education. We want to develop a globally relevant One Health curriculum. With research, we want to drive collaborative transdisciplinary research. With collaboration, we want to build national and global partnerships. And with outreach, we want to engage in schools, the communities, and the public. So first of all, if we just go through our education slides. So basically, as I said, when we're in negotiation with the WHO to become a collaborating centre, we are given deliverables. One of this is to create a WHO-supported Principles of One Health learning module, which can be rolled out to undergraduate, postgraduate, and the workforce. So basically, this module will align with the quadripartite agreement and the joint plan of action on One Health. And it will form the cornerstone of our MSc in One Health, which is currently in development. We also see ourselves hosting summer schools. At the moment, I think it's in June, we are hosting the Universitas 21 summer school here in UCD. We're co-hosting and on the topic of One Health. And next year, we are helping out with the Una Europa One Health summer school as well, which will be on campus in UCD. Also, with our WHO partnership, part of the Collaborating Centre remit is also to help work to support enhancement of One Education and One Health education throughout Europe. When it comes to research, we're currently in the process of creating One Health clusters across key priority areas on campus. At the moment, we have a expression of interest with 7 different areas, and also we allow participants to maybe nominate an area that they think might be of interest. We have 117, I think, replies at the moment, so there was a lot of interest shown, and these clusters are going to focus on research and innovation, but also on teaching and training, and we're hoping we'll move forward very quickly now once we get all the expression of interest in. As I said, the focus areas again are AMR, health equity, food security, climate change, pandemic preparedness, and literacy. So that's our internally within UCD, but also externally, we are currently in the process of trying to launch an All Ireland One Health network, which will include research institutes, policymakers, non-governmental departments, and industry. So this network, we hope, will focus on research, capacity building through training, public engagement, and political and policy influence. Also, we would like to consolidate our existing international partnerships, which include UC Davis, Edinburgh, Zoetis, Una Europa, or UMC, which is a medical school run through the Royal College of Surgeons and UCD in Malaysia, and also Universitas 21. We're also very interested in seeking new international partnerships. So when it comes to collaboration, as I've just gone through, we are establishing an All Ireland One Health collaborative network. This is going to be open to universities, government bodies, NGOs, industry, and local authority. We're hoping to have shared charters, joint projects, and knowledge exchange, and help to realise national capacity through distributed leadership. So just a tiny little bit about how the centre is run. So we've got a very inclusive and agile governance system. We have a steering committee which has representatives from all of the UCD colleges. We then, as I've said, we've created clusters. We're involved in the All Ireland network, but we're also involved in several other networks globally. And we have a membership, which we currently have approximately, I think it's about over 400 members now. And we're supported by project management and also by the WHO Collaborating Centre infrastructure. So when it comes to outreach, as I said, we have our annual One Health Centre conference. We held it last year in December, and I think we had over 130 attendees. This year, we're trying to build it up to 250. It's on the 9th of December in O'Reilly Hall in UCD. So it's just a little bit of a pitch. But also as a centre, we have themed events with national and international partners. We are supported by a seminar series, and we have student symposia and book clubs. And we see this as a space for community learning and shared action. So when I say that we have a membership scheme, any of these events that we're holding will be circulated through the membership email. But also we're involved in a variety of different networks, both in Ireland and internationally. And when these networks are holding interesting events as well, this would also be circulated through your membership email. If there's any kind of research opportunities or workshops or anything like that, we also would communicate this through our membership email. So I suppose outreach beyond UCD, and we're hoping over the next while to be able to reach out to primary and secondary schools and through our outreach group. As I said, we are participating in summer schools. We are creating digital toolkits as part of our WHO commitments. And we're also very interested, as I said, like the idea with the project on health literacy, on community engagement. Another task that we have for the WHO is to contribute to their knowledge archives and global materials. And we will try to continue to connect local and global through education and communication. So as I've continued to say, it is an inclusive membership. Anyone can join, and then they can decide the level of commitment and what they're interested in. So I'm hoping that today that there will be a little bit of interest. I have the contact details there of the centre. So we've got the centre website and also our Twitter and a link to become a member. And finally, there's a QR code to help join.
I suppose just to start out, you have a big job of work ahead of you. It's just when I was listening to you, like there's so much to do. It's such a massive area. It's one thing to talk about working inside the walls of Ireland, but you're trying to expand globally. The first thing that occurred to me is we all work in different sectors, right? So we have agriculture, we have health, we have lots of different sectors. So we have loads of things going on, business, environment. The question is, are we too siloed even within our own sectors? And if you expand that sector to sector collaboration, are we hugely siloed? Are we just completely blinkered in how we work globally and nationally?
I think definitely, I even think within UCD. So the idea of the clusters, I think this is going to be effective internally, but also externally outside UCD. We're hoping that the network will also help with this. So for example, I would go and meet people in UCD. I would meet a lecturer and we'd have a chat. And then the next day I would meet somebody and they would be working on not the same area. And I think this is where the point is they could be working on one aspect of AMR. Another lecturer could be working on a different aspect of AMR, but they might never know that they're each other. So I think this is why the clusters are really important. You're getting people in the same room that are working on different aspects of the same area, which they might necessarily even think have any overlap or have any input in. But actually, it's true. So I think with One Health in particular, because it's a framework, and as I said, it involves multidisciplinary approach. And I know that word is probably overused quite a lot, but really for One Health, that's how it has to work. That's where we're trying. That's why everything is about connecting. We kind of see ourselves as like almost matchmakers, like introducing people to each other, but also we see the centre as a central where somebody can come and say, well, do you know anybody working in this area, or what do you think would make? I think what happens sometimes, and especially with research, which I have a bit of experience in, is that, a grant call comes out and suddenly everybody's like, quick, I need this person, I need that person, but it would be really more helpful if everybody had identified what it and knows what everybody else is doing beforehand, so they can see it as building blocks rather than a bit of a mad kind of rush or a dash at the end to see this. I suppose in one way, with agriculture and food science, the school in UCD, I worked there for about 15 years, and it's one of those schools that has a wide spectrum of research. And I suppose with agriculture and food science, it does stretch. And with food systems, it stretches across a lot of different areas. So it's something that I would be more familiar with, say, than maybe in a different area where a lot of people would work either on the same thing or on something similar. I've seen how effective it has been, how effective the system approach has been with food systems, and how important, say, for example, sociology is in part of that role. So it's just a matter of trying to get people together, and that's the really important part. And I suppose today that's why there was a lot of discussion about creating networks, building, because this is the only way that we're going to get One Health to work and to put into operation. It's to do that.
And there is a lot of connections, a lot of time, meetings, administration. What's the story with funding? How does that work?
Well, basically, at the moment, we've currently got funding to employ me as a part of the centre. However, what we are doing is we're looking out and finding people that are interested. We're setting up groups. We're hoping with these clusters that they will be self-managed. There will be a lead, and then the clusters will report in to a management committee. I suppose at the moment we have 4 interns, which we're very delighted to have for the summer, which will help out a little bit with work. We are seeking funding through research grants, but I suppose hopefully if we set up our All Ireland network, maybe this will be a kind of a group of people that will maybe be able to kind of ask for more funding or try and see how we can discuss where funding is going in different areas. But I do have to say that I think that a lot of the funders are looking towards a One Health approach. Even we're seeing changes in funding calls that are coming out from, say, the Department of Agriculture, like One Health is there in name, and we are seeing a little more. And also at a European level, One Health would be viewed as a very important framework, and so hopefully we'll seek some more funding there.
Yeah, I think everybody's looking for more integration and collaboration. That seems to be the key to success everywhere. The one thing I suppose that when you're talking there, you mentioned a lot of areas of interest that you're working in and that you're trying to pull together. But how are you directed, or how do you kind of prioritize the areas that you want to work in and maybe the impact that you're going to have? Because sky's the limit where you could work.
Yeah, I mean, that is true. And I suppose, as I said, we do have a strategy, we have an implementation plan which guides us. But also, I think, and what I have learned since I started this job is, you don't know who's interested as well. We get approached quite a lot, and it's just trying to make sure that we can become involved. When it comes to priority areas, as I said, we will have clusters. But also when we sent out the call, there was, there was a part of it is, can you think of another cluster which you feel might be worthwhile? I do think through them as well, we will be able to recognise a little bit more about what areas are important, even the feedback that we're getting, how popular one cluster will be over another. These are kind of areas that will guide us as to where the interest is, because I think having people that are interested is part of the motivation to actually achieving anything. It's the same with the network. Once we start reaching out, people across Ireland, these groups talking to each other, then we can see where the interest is and where we might be able to make a change.
Yeah, Mark, plenty of questions coming in there now.
Yeah, the questions are coming in here hot and fast. Niamh, well done on a super presentation. I suppose one of the first questions there, can you give us an example or two maybe of One Health?
Well, I suppose when it comes to kind of One Health projects, there's a variety of different examples. So one that I can kind of give that we kind of use as example is basically there's the idea of suddenly, so in northern Nigeria, that what they were kind of noticing was that like ducks were kind of starting to disappear, and they didn't really know why. Next, what happened was children started to get sick, and suddenly started getting very seriously sick, and they had headaches and vomiting, and unfortunately resulted in tragedy where there was some deaths. So they couldn't really work out what was happening. And eventually what they worked out was there was a lot of mining that was going on locally. So what was happening is workers were coming back with lead on their clothing and spreading it into the environment, into the soil. So to solve this problem, they kind of used a One Health approach. They looked and they said, well, what's the effect on humans? What's the effect on animals? And what's the effect on the environment? If they're just looking at one thing and saying, right, this lead is causing a problem, let's just get rid of, let's just stop everybody working in the mines, or that's not possible. You have to look at all the different areas. You have to look at the three different aspects there to try and solve the problems. So part of the problem is, part of the solution would be to educate, rather than stop people and saying you can't do that, is to educate people on how to improve the situation. Also to try and clean the environment, the soil out. It would be very costly, but they could clean some of it and then try and see if they can prevent it in the future. So I think the difference between One Health and a traditional approach is people might just look at one aspect. They see a problem and they say, right, I'm going to solve that problem. But what they're not doing is they're not looking at how it is affecting animals and the environment and plant health. And therefore, they're creating another problem. There's a great example of before they had an idea, I think, that there was this policy brought in, and the idea was that in the 1950s that they were going to get rid of I think it was swallows, I'm not sure, but the bird so what they did was they went, right, we're going to get rid of them. They're pests, we're going to get rid of them. So they got rid of them. Next minute, beetles started growing on crops. The crops all died. And then it created a famine. There was no food. So in that case, again, people just looked at one problem. Right, we're just going to get rid of the pest. We're going to get rid of that problem. But then instead, they created a much larger problem. So I think that's part of it. And especially nowadays, with the growing global challenges that we have, there's a lot of different aspects to that as well. People can travel. Things get spread around a lot quicker. As we've seen during COVID, we've had a pandemic. We don't know what's going to happen in the future. So I think very similar to food systems approach, where we look at the whole entire range of food systems. One Health is just trying to solve these problems looking through the lens of animals, humans, and the environment, and making sure that when you make changes to one, that you're not actually causing more difficulty and creating problems with the others.
No,
if that makes sense.
That's perfect. No, that's brilliant. Like as you say, the function is you're driving that integration. It's all systems, and the systems are thriving together. There's another question here, Niamh. Do you see the climate ecological crisis cross-cutting a lot of other aspects of One Health?
Yes, definitely. So, for example, an example would be the effect of climate change in UCD. That we're talking about the effect of climate change on pregnant women, on the increase in heat. How is that affecting? So, there's lots of different ways in which climate change can cross over with One Health, and a One Health approach can help with climate change. Again, if we can see the problem, we can see how it's looked at through the lens of three different aspects. And so before we start implementing solutions, have we checked to ensure, again, that we're not affecting something else? Another aspect would be like urbanization. So there's going to be 5 billion people living in cities in 2030. So when we look there, do we have a suitable environment for human well-being and for animal well-being? How can we improve on that? We can look and we can say, well, is there noise? Is there traffic noises allocated closely to where parks are, which have been created to try and help human and animal and environmental well-being? So things like that. There's a variety of different, you'd be amazed at the different applications. Like another thing, one of the projects going on in UCD is involving with dog bites as well. I mean, that's become a huge problem during COVID. Where animals where pet owners were unable to kind of get the training that were required for dogs. There was a huge increase in people in dog ownership during there, and it's caused a major problem. Another example of a project that we're working on is on Q fever in Ireland. That would also take a One Health approach, that affects both the environment and the animal and the human. So there's many different areas in which the framework can be applied.
Niamh, what is Q fever?
So Q fever is basically, it's something that it can be spread from soil to cattle, and then it can be spread to the farm owners. And basically, it it's suspected that it might unfortunately cause, it can cause abortions in people that are working on the farm. So for example of that would be like the project that we're doing at the moment is first of all to try and work out the prevalence of Q fever in Ireland. And then secondly, what would be the right way to hand out advice? Is it in different areas? Is there doctors? Is there some kind of way of getting to the community and warning about it? So that's currently at the moment. So the project is actually on trying to work out the prevalence. It's being done in UCD and also in collaboration with its Department of Agriculture funded project.
Or something like that then. Do you just look inside Ireland and you pull some agencies together, or do you maybe look at research beyond Ireland and see how they've dealt with it and try and pull those in as well?
Well, with Q fever, yes. Well, initially, first of all, it's part of the DAFN policy call, and basically, so they kind of propose the project. But I suppose with Q fever, there's different rates of prevalency that has been discovered around Europe and in the US, and I think there's kind of a bit of a disagreement over how prevalent it is. So I think it was something that the department was interested in doing within Ireland. In UCD, the Centre for Veterinary Epidemiology is located. It's actually, I share my office with the centre. So they're one of the main leads on this project. But they're also working with different agencies and research centres in Ireland on this project to try and see if, first of all, they can work out how prevalent it is. I think that's one of the major problems. Whether it's been overstated or understated. So
Okay.
again,
Sorry, yeah, that's brilliant, Niamh. There's another question in here as well, Niamh. It's there's a person looking, they're interested in joining One Health. You know, can individuals join? And again, what is the contact again, please?
okay, so basically we are a very inclusive membership, so anyone can join. And then depending on your interest, your engagement can then be decided by that. I have a QR code at the end of my slides, and also there's a link that maybe we could circulate the link later on. So there's just a brief membership form to be completed, and then you will get added to our circulation list, and that will keep you updated on any events or funding or anything like that that's available.
Okay, that's brilliant. There's another question here as well, Niamh. What's involved in the principles of One Health, and you know, who should attend?
So basically, that module that we're creating is it's in conjunction with the WHO, but we also work quite closely with a European network. It started off as a call centre. It's called Network for Evaluation of One Health, NEO. So their research has been centred around exactly what type of training in One Health, what type of areas should we be looking at when we come to training people on putting One Health into operation. So the idea of that course would be to give a general overview of exactly what I've just said, how important areas such as trust, what competencies such as trust building, such as, you know, backgrounds into the traditional One Health areas, but also all these other areas that I've just discussed, sociology, misinformation. So that's what that one module is trying to encapsulate. It's kind of a summary of One Health and how to put it into operation. So I would say we are aiming to build this module for the workforce, but also for undergraduate and graduate levels. And we're hoping to building it online. So it should be available. We're currently working on it at the moment, as I said.
Very good. There's another one that leads on nicely to that one there. Again, the summer schools. Again, can anyone participate, or is it for students only?
So the Universitas 21 summer school that we're hosting in the next month. So Universitas 21 is a network of 35 universities. So that summer school entry would be basically to members of those universities. And Uni Europe again is an alliance between 11 universities. However, what we're hoping to do down the line is to develop our own summer school, so that everybody could attend. So the idea is we've got two that we're testing out. We're testing the format and seeing what works and what doesn't work. And then we're hoping to build our own summer school in the future. So we've got the masters, the module first, masters, and then summer school at the same time. So we've a lot of work to do, is what I could say.
Very good, very good. No, it's all good. There's another one here. It's a little bit of a long one. It may or may not be your area. It's the question is, I've encountered a local authority who believe all footpaths, even in the country, should be of tarmac or concrete. Does this make sense in an era of climate change, sustainability, rainwater retention on site, and preventing nutrient loss to rivers? So, does this come in under your breach, Niamh, or is this an area that you would be future
I
proofing, let's say, or engaged in or involved in?
I think we'd have to know a little bit more
Okay.
about the actual particulars. But just to say that urbanisation is an area and that we would be interested in, and improving environmental health and people's well-being. So it just really depends on the more details of that project. But
If
could
if
possibly.
somebody has something specific or some kind of problem that to come across to think that is an issue, how did it come to you with it? Maybe to see if you're interested in it, maybe that you could help.
Well, I think what we kind of see ourselves as is kind of almost matchmakers, or kind of so basically we would be involved, as I said, with a lot of networks. So we try and keep in contact. If something comes in that they would be interested in working with us on, then they come and contact us. The way that the WHO Collaborating Centre also works is, so if when people approach the WHO and ask for certain projects or have an interest in something, and then the WHO then would pick the collaborating centre that would work best towards the problem that they're looking to solve. So we would be contacted by the WHO then and asked to get in contact and to work on the project separately. So that's part of our remit as a collaborating centre. So I think that really helps in the European region and globally. I suppose in UCD, as I said, we're having a conference. We also have these clusters. So that should be part of the communication there. And also with the All Ireland network, that's what we're hoping, that it'll be somewhere that somebody can come. And I think that, and especially when we talk about silos, we talk about communication, we talk about problems, and we talk about, well, where does everybody go? And that's what we see ourselves as. We're creating areas and places and groups where people can come. And then through our networks, through our communities, we should be able to then try and see if we have the connections to solve the problems.
Okay, there's another question here as well. I suppose around that future proofing area, is there sort of a priority list, Niamh, or are you working to, is it climate change? Is there say a top 5 areas of priority as we speak, or how does that work?
So basically, as I said, with our centre, one of our key aims is to put One Health into operation and to try and see if the framework can be applied to many problems, not just existing ones. As I said, with the clusters, we haven't. There's no order of priority. So there was kind of 7 areas, which include the ones you've mentioned: climate change, pandemic preparedness. And I think then seeing where the interest is, and the group of people that maybe, one cluster might be more successful than another. And we would kind of say, okay, well, maybe we need to make an improvement in that, or maybe that area just isn't of interest to people, or maybe it's not a priority. But I think a priority is kind of when somebody approaches us and says, can you do a project in this area? And so I wouldn't be able to kind of go, oh, okay, well, AMR is the worst and, climate change is next. They're all global
Okay.
challenges that have to be
Okay.
solved. It just depends on where you can make the difference.
Niamh, you mentioned in the presentation about misinformation and maybe trying to combat misinformation, and it's something that comes up in our house a lot because Dr. Google often answers
Yeah.
many questions, and we're from research backgrounds, and there's some heated debates around the kitchen table sometimes when someone comes out with a point, if it's brought off Google, or now we have AI now as well, that Yvonne is in the background, and she hates us mentioning her, but she has a great saying that rubbish in, rubbish out, and that can happen a lot. I suppose, how can you combat when you talk with misinformation? How are you going to achieve that?
Okay, well, when it comes to misinformation, actually, there is a collaborating centre that works quite heavily on this type of information. So I suppose the question is, first of all, what is the area? So if it's something like AMR, how do we improve that? So people go on the internet and they just find out any information at all, and they don't know whether it's true or they don't know. So how can we improve that? First of all, as I said, when I talk about projects on baseline health literacy, what is the information? What do people think? Because I might think something totally different from somebody else, or how do you actually work on that? So as I said, health literacy is a very important part of our centre. We need to work out what are people's understanding, but second of all, then we need to combat that with solutions. So I've been to a few kind of research seminars where they talk about this, and just to give you a couple of examples, when it comes to something like AMR, some of the ideas that they were touting is virtual reality headsets in doctors' waiting rooms. So before somebody goes in to the doctor, that either there's posters or information leaflets, or they were saying virtual reality headsets explaining the concept, so that as they're waiting, they're getting an education on how to improve their literacy of the area. Another thing that they were talking about is misinformation and people, and how to change people's opinion. Like, so somebody has all these theories, and there's certain approaches, there's certain techniques where you can meet and you can kind of negotiate almost. You don't dismiss somebody immediately. You would use these negotiating techniques to, first of all, what's very important is putting the person at ease so that they can actually say what they believe. Because some people don't want to say what they believe. And then after that, it's kind of a logical steps, talking through why or why not that might not be true. I mean, I think that there's some of the things that we could be doing, but as I said, it's almost like knowing what misinformation is out there first and how it affects people is another area that we'd be interested in researching.
It's interesting. I just picked up something you said there about making people feel comfortable so that they can say what they mean. And now we have social media where if somebody puts out something that may be a fact and a true fact to take for our environment, for example, or whatever it may be, that you get torn apart on social media. So are we going to be more oppressed maybe to not speak out, maybe, or even sometimes our farmers are doing a lot of very, very good work, but they can kind of get hammered sometimes as well, even though they're working hard to try and solve environmental problems, for example.
Oh, I know. I definitely know that. I suppose that's where education kind of comes in. I think people get confidence in when they're sure. So if, first of all, where are the problem areas? And as I said, I'm just giving you the example of the survey that's currently done. What is people's current thinking? Where are the problem areas? Offer education in those areas. People become more confident because they feel like they have gotten the information from a trusted source, and they can be confident in what they believe. So I think that's one of the ways in which it can be combated. But I mean, social media, it's just exploded, and as well as that, the internet. I mean, you could really find anything. Sometimes I think people go to the internet to find the answer that they want to a question, and you can definitely always get people to agree with you no matter what it is.
We all want to be right.
Exactly. Well, they told me here I'm right. Well, yeah. So
we have another question in here, Niamh. Is there a possibility in near future for a workshop to be located at UCD?
For a workshop?
Yeah, workshop.
No, in the future we will be hosting workshops. We will, as I said, the seminar series. So, and both internally in UCD, but also, online, so that our members from outside UCD can join and all the rest. So yes, we're hoping to do that in the future as well.
And what's the duration, Niamh, of a workshop? Is it a number of days or?
Can depend. Normally I would say workshops are normally half day or 1 day, or sometimes they have 3-hour workshops. It just really depends. Currently, we're kind of working on our kind of outreach initiatives, so we'll have more information in the future about that.
Okay. Very good, very good.
There's a question around TB there as well. Are you doing anything on TB? Actually, it's I suppose from going around farms at the moment, it's rampant around Ireland. So a lot of people are looking for some answers, and this is a really interesting one for you because I know there's a lot of debate at the moment about how the whole TB situation is handled as regards the movement of disease and how we manage that situation. Some people feel it's maybe not the way to do it, and other people feel that, how else can we handle it? I suppose about culling of animals and that, of badgers.
Well, so just to say about TB research. So as I said, I share my office for the Centre of Veterinary Epidemiology in UCD, and they do a lot of research on TB. So yes, that is definitely a One Health problem. There is a lot of work currently going on, but I do know that it's one of those problems that's just not going away, and it can just be almost impossible to maintain the level. So yeah, I think things like modeling on movement, there's research going on with that at the moment, like as in what happens how is it spreading? What is causing it to spread more? What type of movements? Is it internally? Is it from farms mixing with farms? So there is that research is going on, but that's more, I suppose, in the remit of Severa. We could take a One Health approach to it, and we do work with them on projects, as I said, but within UCD, there's a lot of work, and I'm sure you're probably aware of that in that centre.
Yeah, and you mentioned your work with the South Sub-Saharan and Africa, and Teagasc do a bit of work in different parts of the world as well. Can you maybe tell us a little bit more about that? That sounds very interesting.
Well,
two-way learning.
at the moment, we are trying to seek, I suppose, more research opportunities there. We're currently, we've submitted funding applications for some projects, and we're just waiting to hear the answer. But that is an area that we would like to investigate more. UCD have an Ireland Africa strategy at the moment, so we're trying to get involved in the future if there's any incentives going there. And also the UCD School of Ag and Food Science, they also work very closely. They have the Centre for Humanitarian Action within UCD as well. So we're hoping to work with them in the future.
Yeah,
so that's part of our aims.
Yeah, no, it sounds super. We can all learn from everybody. The another thing I know you mentioned a number of times, antimicrobial resistance, and be it a human or going getting penicillin, or be it an animal, we have that cross sectors. Is that high on your agenda? Because obviously that's a global issue. That's not just inside the walls of Ireland.
But I suppose AMOR would be a very traditional One Health area. Yes, it is. Within UCD, there is a variety of people working across different colleges on AMOR. So, as I said, I think that's probably going to be one of our most popular clusters. And the hope there is to get, as I said, different disciplines in the same room that are working on different aspects and try and see what we can build from that. But there will be research going on in UCD on a lot of aspects of AMOR. So hopefully we can move on with that as well. But also, as I said, look at and make sure we're involving disciplines such as sociology to help with, and also policy to help with trying to prevent the spread. Because again, it's one of those things that it's very complex. It's a complex problem. It needs to be looked at from all different areas. And as you said, it's globally. Everybody is very interested in AMOR at the moment.
I think Mark will be very interested from the work that he does with our climate change and working with our farmers. We got some news during the week that things are not going as well as we would like in regards to our meeting our targets. Is the climate change high on your agenda?
Climate change, yeah. Again, climate change is nothing that's high on our agenda. In UCD, they are very interested in climate change as well. I think there's going to be a centre, possibly, and we will work closely with them as well. So I suppose it's linking in with all these different research groups and seeing how the One Health approach can be implemented for some of their research and help out with climate change. But as I said as well, it is a cluster, and we are looking to get members from all the different colleges around the UCD that are working on climate change. I think most of the problem starting out is identifying people, knowing who's doing what, and then you can see the possibilities. And I think these clusters are going to help us with that.
Yeah, I think coordination is the key, and I think the more the people get to know about you and what you're trying to achieve, you're going to get an awful lot of requests and questions like exactly what we're asking, coming up with specific topics, specific issues, and I'd say your biggest issue going forward is going to be trying to prioritize the most impactful ones that you can get the best bang for buck out of, I would say.
Yeah, I suppose when it comes to kind of research and education and all the rest, there is everybody's doing their research, but there's no time for everybody to kind of join together. And we might say, okay, you're forming these networks or whatever. It hasn't been done, and it needs to be done. That kind of way. So hopefully, we're going to be in the center of all of this and helping to build those networks. And as I said, getting the right people in the right room
Yeah.
to try and solve problems.
And on that, like when the research gets published, sometimes the next round of research comes along and the next round of papers comes along. So I'd be hope that what you're trying to achieve is to anything that we find out to get the impact on the ground. So it's actually, it's actually meaningful and it actually happens.
Yeah.
So, yeah, I think.
Well, I think it's getting the most out of the research that is currently being done. That kind of thing, making sure that it's followed through, that it's successfully implemented as well. It's it's great. It's fantastic to find solutions, but then they need to be implemented so that everybody can benefit from them.
Yeah. Unfortunately,
What's
I think
the best way of
Sorry, go ahead, Mark. One last
okay,
before we go.
there is a request for your contact details there, Niamh. Is it by email?
Contact me directly by email, and I can
Okay.
send on any information that's required. So my email address is just niamh.mclaughlin@ucd.ie. So it's just my name with a dot between the H and the M at ucd.ie.
Brilliant. That's brilliant. Thank you.
That's super, Eve. Unfortunately, that's all we have time for today. And but just like to thank everybody for putting all through their questions. And Niamh, that was a really excellent presentation. Very interesting subject, and really looking forward to see how this advances and where you go with it. So thank you very much for the presentation, Niamh. And
Thank you very much for having me.
No,
Delighted.
you're very welcome. Mark, thanks a million for helping out the questions today. Oh, brilliant as always. And also thanks, Mark. I also like to thank Yvonne Marr in the background who helps with the management and running of the webinar and I suppose makes us look good up at front all the time. So next week we have Teagasc researcher and remote sensing specialist Dr. Stuart Green who will join the webinar to talk about farm carbon stocks monitoring, reporting and verification. And that's not to be missed. So do tune in again next Friday at 9:30. Slán go fóill.
You've been listening to the podcast version of the Teagasc Signpost Series, the weekly webinar that promotes and examines sustainability in Irish farming. Don't forget to join us live every Friday morning for our latest webinar. For more, visit teagasc.ie. And you can also rate, review and subscribe to the Signpost Series on Apple Podcasts, Spotify or wherever you get your podcasts from. I'm Mark Gibson and thanks for listening.